Despite new law, HIV cases rising. Third of the series, Manila, Philippines. Even before the nurse handed Patrick the results of his HIV test, he knew it would say that he had contracted the human immunodeficiency virus. He knew this was the consequence of the decision he made 3 months prior, when he agreed to have unprotected sex with his then longtime partner, who was then already infected with HIV. "I was blinded by lust," Patrick told the Inquirer when asked why he knowingly had unprotected sex. He said that at that time, even if he was already working as a private nurse, his partner would batter and accuse him of seeing someone else because of his partner's condition. In an effort to end all the doubt, he told his partner on that fateful night in 2017, "Infect me. It was because of lust," Patrick declared. "I saw him as the person whom I was going to spend my lifetime with. I was ready at that time. I knew what I was doing." Such risky sexual behavior was nothing new. It was evident as early as 2009, with the Department of Health, PLH, study finding that a high level of understanding and knowledge of HIV did not necessarily translate to a strict adherence to safe sexual practices. According to Dr. Avelino, a focus group discussion conducted for the study shows that sexual attraction is one of the key factors that explain why knowledge does not turn into action. 4,274 cases in April. The Dose Epidemiology Bureau saw 840 new infections in the Philippines, bringing this year's total to 4,274 cases. The number is higher than the 3,226 and 2,471 cases recorded during the same periods in 2018 and 2017, respectively. The majority of those newly infected in April are men, comprising 94% of all cases. More than half of those newly diagnosed, or 475, contracted the disease through male-to-male sex. The number of rising cases has often been tied to the speed of finding, and accessibility of, sexual partners today due to social media and the abundance of dating apps. Since January 2014, the total reported number of people with HIV in the country has stood at 49,827. The DOH reported in April that 37,091 are taking the free antiretroviral medicine. HIV epidemic. A viral infection, HIV attacks people's immune system, making them susceptible to opportunistic infections such as tuberculosis. It can be transmitted through sex with an infected person or sharing of needles. The rate of new HIV infections has been a cause of concern among health officials, especially because the most recent report by the Joint United Nations Program on HIV/AIDS shows that between 2010 and 2017, the HIV epidemic in the Asia-Pacific region expanded the fastest in the Philippines, at 170%. To deal with the HIV epidemic in the country, President Rodrigo Duterte signed early this year Republic Act No. 11,166, or the Philippine HIV and AIDS Policy Act. Apart from lowering the age of those who can have themselves tested from 18 to 15 years old, the law also ensures that vulnerable populations such as the youth are better informed of their sexual health. Parents will also be made to participate in awareness-building seminars for them to be knowledgeable on gender responses and age-sensitive HIV education. RA 11,166 also provides that no people with HIV should be denied private health insurance or life insurance just because of their condition. It also sets stiffer penalties for violators, like those who would discriminate against adults. Imprisonment may last for up to 5 years and fines may be set to up to P500,000. If you are lucky despite all that, however, Avelino, the officer in charge of the Dose Epidemiology Bureau, admitted that the government could only do so much to curb the spread of HIV. The biggest part of the intervention is internal, he said. It left square bracket depends on right square bracket the person. Left square bracket even with all the interventions right square bracket, if he doesn't want to practice left square bracket safe sex right square bracket, nothing will happen. Avelino raised the need for family members to not only strengthen ties but also to become more open with one another. Studies show that if you are loved and have a sense of belonging in the family, you won't look left square bracket for these right square bracket outside of your family. But if you do, you become more responsible. There should be openness, with no malice, no judgment, he said. In the next couple of years, the burden of curbing the rising incidence of HIV in the country would not lie as much on the government, Avelino said. Thank you for watching. Please subscribe.